Gentlemen, if you think your daily habits have no impact on your prostate, think again. By the time John reached 45, like countless other men his age, he began to notice some unexpected changes during his regular morning routine. His prostate was sending signals that felt entirely unfamiliar. For years, these signals were either brushed off or misinterpreted. But what followed completely altered the way John understood his body. The prostate, a small gland often ignored, actually holds far more importance for a man's health than most people recognize. Many men live under the impression that their daily habits are perfectly fine, when in reality, some of these so-called normal routines may quietly be causing harm. In today's video, I'll reveal 3 surprising ways your prostate changes when you engage in daily masturbation. And believe me, the third one will fundamentally change the way you think about both your habits and your health, especially as you grow older. The prostate, a delicate gland, roughly the size of a walnut, plays a critical role in male health. It processes fluids daily, fluids that either nourish it or gradually cause harm. Without regular upkeep, this gland can quickly become congested. Picture a garden hose left unused for months. The water struggles to pass through and blockages soon form. Based on my years in clinical practice, I've seen firsthand how easily prostate congestion develops when regular maintenance is neglected. One of my patients, a 65-year-old executive, ignored his prostate health for years, partly due to cultural discomfort surrounding self-pleasure. By his mid-60s, this neglect led to severe fluid buildup, triggering urinary struggles and chronic discomfort. What's crucial to understand is that this outcome could have been avoided with basic, regular self-care. Meanwhile, another patient, 70 years old, made self-stimulation a regular habit, doing it 3 times weekly. His prostate health metrics were almost identical to those of a man in his early 40s. The difference in their overall vitality was staggering. The key message is clear. Your prostate needs regular flushing to stay healthy. Without that, fluids accumulate, discomfort sets in, and long-term damage becomes a real risk. Every time you ejaculate, your body experiences a temporary drop in DHT, dihydrotestosterone, a crucial hormone for male development. But DHT also plays a role in prostate enlargement as you age. During ejaculation, DHT levels momentarily decrease, giving your prostate a brief break from the hormonal strain that contributes to enlargement. I recall treating 2 brothers, both in their 50s. One regularly engaged in self-care, while the other saw it as inappropriate for his age. The difference in their prostate health was shocking. The brother, who maintained a regular routine, showed significantly lower PSA levels and far fewer urinary issues, even though both were of the same age. Through my clinical experience, I'm amazed by how few men realize this hormonal reset exists. With regular moderate activity, the body naturally manages hormone levels, reducing the risk of prostate enlargement, all without needing expensive treatments. Every ejaculation initiates a remarkable internal reset within the prostate. The muscle contractions that occur act like a pressure washer, clearing away excess fluids and cellular debris. This process improves blood flow and encourages fresh, nutrient-rich secretions, both essential for long-term health. In my practice, I've encountered many men over 50 who mistakenly assume they're too old for regular self-care. They worry about judgment or social stigma. But the reality is, regular self-care becomes increasingly vital as you age. One of my 70-year-old patients, who kept up with his routine, had prostate markers superior to some men in their 40s. This simple act fostered ongoing cellular renewal and vitality. Think of it like changing your car's oil. If you never change it, the engine eventually fails. Likewise, your prostate needs regular cleansing to keep working properly. As you grow older, maintaining this habit becomes increasingly important. Just like any part of the body, the prostate requires regular attention. For men in their 40s, I recommend 3 to 4 sessions weekly. In your 50s, 2 to 3 times is ideal. After 60, at least once a week, helps sustain prostate health. Many of my patients express fears about aging and its impact on sexual health. But staying consistent with a routine is critical for overall well-being. A 65-year-old executive patient who once ignored his prostate saw drastic improvement in his PSA levels simply by establishing a regular self-care habit. Regular ejaculation even enhances sleep quality, easing stress and promoting relaxation. And let's not forget, sleep is vital to overall health, especially as we age. Caring for your prostate isn't only about physical symptoms, it's about preserving mental and emotional well-being. Many men who maintain regular self-care feel less anxious and more confident. This practice also strengthens pelvic muscles, supporting better urinary control and lowering the chances of erectile dysfunction. If you're in your 40s, now is the time to build this habit. Aim for 3 to 4 times weekly. Consistency matters more than intensity. Moderate, regular practice beats infrequent extremes. In your 50s, prostate care should be a top priority. Keep up your routine and adjust as needed. Don't let social stigma hold you back. Even after 60, stay consistent, adapt to your body's needs, but never stop altogether. No man is ever too old for self-care. What's often ignored is the emotional side of prostate health. The shame around self-pleasure keeps too many men from establishing healthy routines. But this is a health matter, not a moral debate. I've spoken with patients like Robert, 58, who felt deep anxiety about his intimate health. Successful in business, yet paralyzed by fear of judgment. Once we reframed self-care as essential health maintenance, his confidence and his prostate health improved. Prostate health doesn't have to be complicated. It's about tuning into your body, responding to its needs, and staying consistent. Build this habit today. Your future vitality depends on it. Take charge now and invest in lifelong well-being. Now that you know just how much regular self-care can impact your prostate health, the next step is simple. Take action. Build a routine that works for your age, stay consistent, and don't let outdated taboos hold you back. Your future vitality starts with the habits you build today. And if this video gave you even one valuable insight, make sure you hit that like button and subscribe for more science-backed strategies to protect your health and longevity.